Current regenerative medicine technologies include platelet-rich plasma, alpha-2 macroglobulin, and stem cell therapy. Think about all three of these as being on a spectrum of regenerative medicine technologies. Now, depending on the patient and the underlying pathology, one or more than one or all of these may be the right fit. So it's important for you to get an appropriate evaluation by an experienced provider who can offer the appropriate treatment or combination thereof. The reason that we've decided to focus almost exclusively on regenerative medicine technologies is because we're using your body's own ability to heal itself. So for example, if we can access your platelets through a simple blood draw and then utilize the growth factors involved with those platelets to allow your body to heal itself, that's a far superior option than injecting, for example, cortisone over and over and over. Although there is a place for something like cortisone, there's no doubt. You want to save that for more of an acute pain flare-up because repeated cortisone injections over time can actually be detrimental. In addition to PRP, platelet-rich plasma, which has been around for quite some time now, we also offer stem cell therapy. Now, there's a lot of conversation these days about stem cells and creating new body parts and science fiction, but the fact of the matter is, stem cells have an increased level of growth factors, so they can help your body heal itself or at least slow down continued degradation. In respect to where to get stem cells from, you can typically access stem cells from a patient's own body, be it the bone marrow or the fat cells, or you can use umbilical or embryonic tissue. We tend to focus exclusively on bone marrow. And the reason for that is bone marrow has the highest quality and quantity of stem cells. We also know there will be no risk of rejection or toxicity, and no preservatives or any sort of manipulation is done at any time. Alpha-2 macroglobulin, or A2M, or alpha-MAC as it's sometimes called, is a particular enzyme located in your blood. So through a simple blood draw, we can access the alpha-2 macroglobulin enzyme in addition to PRP at the same time. After a vigorous process using a centrifuge and some additional processing, we then inject that highly concentrated enzyme into the affected body part. We do that and all of our injections under direct visualization and image guidance. And that could include ultrasound or fluoroscopy, which is a live X-ray. So the goal of A2M or alpha-2 macroglobulin is to decrease or prevent your body's ability of creating inflammation. So if you imagine inflammation is a chemical reaction, if we can stop part of that chemical reaction, the entire reaction eventually fizzles out and your body at that particular body part cannot get inflamed. So this is not an anti-inflammatory where we are attempting to combat pre-existing inflammation. This is actually a disinflammatory because we can eliminate the inflammation in the first place. The beauty of regenerative medicine injections versus a typical cortisone injection is there is much more of a definitive component to it. For example, a cortisone injection may make you feel fantastic and may make the pain go away, but it will invariably return. And then you're looking at a course of multiple injection therapies and potential harmful side effects. With regenerative technologies and regenerative injections, oftentimes they can be curative in nature, avoiding potential orthopedic surgery, for example. Oftentimes, repeated regenerative medicine injections can create more of a long-lasting effect without any sort of deleterious or negative side effects that you might see with something like cortisone. It's incredibly important for a patient to come see us upon noticing pain as quickly as possible. The earlier that I have the ability, or any of our providers at Remedy Pain Solutions have the ability to see and treat you as a patient, the better your prognosis, the greater your chance of success. So if you know you've had a sporting accident, if you know you've had a motor vehicle accident, if you know you have an ongoing pain issue, don't wait. You're only doing yourself a disservice. Come in to see us straight away so we can evaluate it and provide the appropriate treatment for you as quickly as possible, improving your chance of success. All of our procedures are outpatient in nature. So this means there are no hospital stays. Usually there's no anesthesia or no general anesthesia whatsoever. So at the most, you're looking at an in-office procedure where you're in and out in a matter of hours and you can go back to work the next day. Or you're looking at potentially a surgical center procedure with a very similar time schedule. So in general, regenerative medicine here is non-surgical, not harmful, minimal side effects, and potentially high reward, like avoiding orthopedic surgery, fixing or curing an underlying pathology like a tear in a muscle, for example, and providing long-lasting relief without surgery. So as a patient, what to expect when you come in for a regenerative medicine injection? Typically, you'll come in, you'll check into our office, you'll be escorted to the procedure suite, at which point, depending on the type of procedure you're getting, be it a PRP or alpha-2 macroglobulin, you'll receive a small blood draw, or a stem cell procedure, at which point you'll be prepped and positioned so we can access the bone marrow. Either one of those pathways, you're looking at about a 15 to 20 minute process. Once the actual product is obtained, we then begin to process that product using specialized equipment like centrifuge technology, for example. Once we process the blood or the bone marrow, then we get the target product, which could be PRP or alpha-2 macroglobulin or stem cell. Then that product is reconstituted and re-injected into the appropriate area of concern, always under live visualization like fluoroscopy. You're typically done with the procedure at that point. We'll keep an eye on you afterwards just to make sure you're fine and you can walk out of here. So you're looking at about a 1 to 2 hour period from the time you check in to the time you check out of our office. All outpatient, non-surgical, minimal to no anesthesia. Oftentimes, because of the natural process of increasing inflammation, you may notice an increase in pain for 24 to 48 hours after the injection. This is not only completely normal, but this is actually a very encouraging sign. This tells us that the new injectate is doing its job, which is twofold. It's delivering new growth factors to the affected region to assist with healing, but it's also telling your body there is still an active injury here and the body needs to increase its own natural immune response to help heal that injury. After that 24 to 48 hour period of increased pain, the pain typically will dissipate to normal levels, and then as the body's immune system begins to do its job, you may start to notice benefit about a month out, but that can sometimes vary. Always make sure you're being treated by a specialist that has experience and training in regenerative medicine technologies. At Remedy Pain Solutions, all of our providers are board certified, usually double or even triple board certified at a minimum, and have extensive training and experience in these issues. That's incredibly important. This is not like a run-of-the-mill injection that you can go to any old doctor for. You want to go to the right guy who's got a lot of experience, because if you're going to put yourself through this, you want to optimize your results and make sure you have the best benefit.